Hello everyone, welcome back to another video. I'm currently in Tullamore for my surgery rotation, but before I talk about my experience so far, I want to talk about my experience last semester in general practice, which were the first 18 weeks of my third year curriculum. So before I get in the video, I just want to preface that I know my general practice rotation was a few months ago and I'm only filming this now, but took a bit of time to get the channel going, and I did film some things throughout the semester that I'm going to be sharing with you guys in this video, but I figured I'd kind of start from the top and bring you right to the beginning of my third year journey. So in other videos, I think I've kind of hinted at the fact that I was in general practice last semester, but I never really got to talk about my experience. So I figured I'd do that now, and this video is going to be a little different than maybe some of the other videos that I've filmed so far. All the other videos have been non-medical related, but I think it's important to show what my life has been like on a day-to-day basis from a medical perspective, and that starts with general practice. So as mentioned, I did 18 weeks in general practice, and the way things work with my school is you do 18 weeks of general practice and then 18 weeks of a combination of surgery and medicine, so 9 surgery, 9 medicine, the order of which can change depending on what way you end up in the lottery system. But for me, I got assigned to general practice first, so that was the first part of my year. And then now I'm in surgery, and then following my surgery rotation, I'm going to be doing medicine for 9 weeks, medicine being all the non-surgical specialties in the hospital. So I'm actually going to be dividing this video into 2 parts. The first part's going to be kind of like a general overview about what my experience was like in general practice, what I did on a day-to-day basis, and a bit about the town that I was in for my rotation. So I'll talk a bit about that. And the second part of the video is going to be some interesting patient conditions that I came across and what I learned from those experiences. And everything in the second part is going to be obviously anonymized. I'm not going to be talking about specific patients and their identities, of course, but kind of just things I learned throughout the semester and the interesting patient cases. So I guess to begin, well, I started my GP rotation in mid-August in a town called Ennis, and Ennis is about 30 minutes northwest of Limerick, Limerick being where I attend school. So I personally decided to commute there every day, but other people in my program decided to move to their respective towns. But for me, 30 minutes wasn't too bad. I could live with my same roommates, so decided to commute. Now, we were only obligated to do 2.5 days a week at the practice, but I often like to do more than this just to get extra clinical experience. But if I was doing a full day, I usually get there about 9 a.m. and go to 5 or just thereafter. And if I was doing a half day, I'd leave at lunchtime. But like I said, 2.5 days for my school was all that was required, but typically like to do more than this just for the extra experience. So it was a really welcome environment to start off, and was throughout the whole semester. But the first couple of weeks I was really focusing on how my GP took histories, how he did physical exams, and his interactions with patients helped me a lot throughout the semester, and it was a good way to kind of ease my way into the practice. So I'd say from about the 3rd week on out of the 18 weeks, I started taking on my own patients entirely. So I would have my own one-on-one consultations, and I'd focus on good history taking, physical exam, and then what I would be doing is when my GP comes in, I would present the history to him so he's aware of what's going on, and then he would check a couple things himself just to make sure that I kind of did a good job. So we call that parallel consulting, where I do the consultation first, take a good history, exam, present it to my GP, and then he comes in afterwards and checks in on things for himself. And after, we would kind of talk about things together about maybe what I could do differently next time, what kind of questions I would ask, certain things about the exam, etc., and kind of just get some learning points out of what I just did. I think in a general point to reflect on the whole semester, I'm very happy how I improved in that respect. 18 weeks is a long time, and you feel a lot more confident asking questions to patients. I remember the first time that I went in for my own one-on-one consultation, I was pretty nervous. I mean, I've shadowed doctors and been in a GP setting for the last 2 months as an intern, but a lot of that was shadowing various doctors in Canada. But first time doing a one-on-one consultation, was a little bit nervous obviously, but just kind of told myself this is what I'm here to do and this is what I love. So kind of get a lot more confident with things and less nervous with time, and kind of become second nature after that. So over the course of the 18 weeks, I'm kind of happy how I progressed with history taking, exams, etc. Now I'm going to be talking about the conditions I encountered in another video, but I just want to say in general that people always think that GP, you're not going to see interesting cases, and I think that's really not true. although you might not see a lot of the potentially life-threatening conditions that you often see in a hospital, you can see some in GP, and your GP is kind of the first line of defense often, especially in smaller towns, which is very common in Ireland. So you do see a lot of interesting cases, but I'm going to be talking more about that in the next video. So one of the nurses in the practice was my GP's wife, so I got to work with her a lot as well and focus a lot on taking bloods. I certainly think I got a lot better at taking bloods throughout the semester. Hadn't really done those prior other than on mannequins in second year, so that was a really good experience and has helped me throughout the hospital this semester as well. I was actually fortunate enough to have my own office, so we'll pop up a clip of that right here. One of the other doctors who used to work at the practice left about a week or two of me being in there, so got to take over her office, so definitely wasn't complaining and was pretty lucky to have such a great space like that. So whenever I wasn't with patients, I kind of spent a lot of my time in the chill room upstairs, so we'll pop up a clip of that right here. This is just an area that I ate lunch in, studied in when I was studying for my board exams, and the general practice content as well. And we also met as a team. So everyone at the practice, being the GP that I worked with, myself, the nurses, and the 3 medical secretaries as well, and kind of just talked about life sometimes and grabbed breaks together, etc. And I guess just want to say in general that I had a very, very positive experience in GP. A lot of people say your experiences influence your decisions, and I truly believe that. And because I had such a positive experience in GP, who knows, it might be something that I do looking forward in my career. But overall, great experience, and 18 weeks seems like a long time, but it honestly flew by. And I think a lot of that's attributed to, the team members I worked with, and in particular the GP, being that he was so good with allocating his time and spending extra time for my own learning, and that's something that I truly do cherish. So based on the demographic, I know a lot of my viewers are non-Irish. You're probably wondering what kind of a town Ennis was like, but if you want to see more of that, I'm going to pop up a couple clips of me walking through the town and kind of showing what my experience was like, being there on a day-to-day basis. But in general, Ennis is a lovely town, and it's quite small, but it gives you kind of that home Irish feeling. So I was grateful to be placed there for the semester. What's up, guys? Just finished a morning in the clinic, and I'm currently on lunch break, and thought I would walk you guys through the town that I, spend most of my days during the weekend. So welcome to Ennis, Ireland. It's a nice town, just kind of like to walk around, and they got all the essentials here too, so show you guys around a bit. I'm showing that Zest place specifically because the secretaries in my practice were nice enough to get me a cake after they found out I passed my board exam, so very thoughtful of them. Yeah, it's been absolutely great working with the doctor I'm working with. Someone with that many years of experience, and to be able to work with him every day, it's been unbelievable. I just finished a day in the clinic. Long day. It's about 6 p.m. right now. Let's go home, but one of the secretaries said there's a nice Christmas market in Ennis where I attend my GP practice, so I thought I'd check that out and update you guys on that now. I kind of just go right home after my time at my clinic, but it's kind of nice to walk around at night, and this time of year, as I said in my intro video too, it gets dark so early. Nice little monument, not really sure what it's for, but all right, who thinks I'm too old to go on one of these rides? I think it's worth mentioning as well that today was the first day I launched my YouTube channel, so it's currently off the ground. It's December 1st today, and I know I was backdating a lot of the content and posting it anyways, but
Just so you guys get a picture of where I'm at right now, it's December 1st. It's finally off the ground, and I'm excited to show some of my memories from earlier in the semester with you guys. So thank you so much for watching. Yeah, it means a lot. All right, this ride looks sick. Nice little small town Christmas market vibes. A lot of history in this town. Don't ask me anything about it, but there's a lot of history. For any of you historians out there, this is the town to be, Ennis, Ireland. All right, that's it for me. Time to head home. Kid is exhausted from today. Nice little walk around though. Out of breath, what's going on? Need to hit the gym more.
And to cap off this video, I'll throw in a clip of my last day of general practice. Bit cheesy, but that's okay. That wraps up general practice. Kind of wild, it's been crazy 18 weeks. And I'm excited for the next chapter. Definitely a bittersweet moment. Gonna miss people here, medical secretaries, the nurses, and of course my GP I've worked with all year. It's been an unbelievable experience, great 18 weeks. But excited for the next chapter and on to the hospital, on to a new journey. All right guys, so that's it for part 1 of this video. Hope you guys enjoyed and got a better perspective of what my life was like in GP first semester. And in the next video, I'm gonna be talking about some of the conditions I encountered and more about what I learned specifically in GP. So tune in for that one. But for now, thanks for watching. We'll see you in part 2.